Well, welcome back from break. I hope you enjoyed the morning. I know it was fairly informative, but now you're going to get into the real meat of Sage Transparency. We heard all about Chris Whaley's RAND 4.0 and the details, and now we're going to hear about some of the other tools. So I'm very excited to introduce my dear friend and colleague, G. Bai. G is... She's a professor of accounting at Johns Hopkins Carey Business School and professor of health policy and management at the Johns Hopkins Bloomberg School of Public Health. She's currently serving as an invited scholar at the Congressional Budget Office with our dear friend Chapin White. You guys know Chapin, he did RAND 1.0 and co-author on 2.0. And he's the deputy director of health analysis at CBO. So G is probably going to learn even more from Chapin and vice versa. So Chris Severn is joining us today. He told me he landed an hour and a half before the conference started, so welcome, Chris, from California. He is co-founder of Turquoise Health. Turquoise Health is a startup focused on simplifying healthcare reimbursement through price transparency. Since launching in 2020, Turquoise has aggregated over 4,000 hospitals' price transparency disclosure data in a central repository. I met Chris when he was really early on in this adventure. I was so excited that he was doing this. So it's wonderful to see your company has grown and you're offering more services. So thank you both for being here today. And G, I think you're up next. So if you want to come up here, thank you. So this advances the slides and that slows it, and then here's how much time, and both of you.
Okay. Thank you so much, Gloria. It's really my great pleasure to be here. Thank you, Gloria and Christine, for giving me this great opportunity. So as Gloria said, I'm an accounting professor at Johns Hopkins Carey Business School, also professor of health policy and management at the Bloomberg School of Public Health. So I'm visiting at CBO, so the views and the opinions here do not represent the top CBO. I have to make that disclaimer. I'm an accountant, so I'm a bean counter. My job is to let the data speak, let the numbers reflect economic reality. So today, I'm going to present you what the data tells us. So first, colonoscopy. Colonoscopy is an extremely common standard service. All Americans above age 45 are recommended to take colonoscopy. So for this service, there's really no premium for, let's say, Johns Hopkins is so much better than another hospital, right? For such a standard service, let's look at the distribution, the variation of the commercial negotiated price across hospitals. So this is a study we published earlier last year on the Health Affairs Forefront. We look at the colonoscopy. So this is distribution among all the hospitals that disclose the price in compliance to the hospital price transparency rule. So the bottom, you see there are hospitals who have median negotiated price below $500. So some of them $400. On the top, hospitals are having more than $8,000. This is their median negotiated price. This is not their charge. All right, so they can have more than, let's say, 24 negotiated price. We take the median, and the median can be above $8,000. So what is the variation? 20 times, right? 20 times in our country. We published an article on the journal Radiology, a top journal in that field, earlier this year. So we look at 13 radiology services that have been designated by CMS as shoppable. So meaning that they are very common, they're elective, can be scheduled in advance. So here's what we found, a very small font. So let me just take a snapshot. So CT scan of the head or brain, the top one. Okay. For this service, by the September 6th, so this is already 8 months after the implementation of the hospital price transparency rule, we have about 51% of hospitals, so only half of hospitals, disclose the commercial negotiated price for the CT scale brain, which is extremely common radiology service, right? And then the median negotiated price is 813. This is the median of the median. So 813. The price IQR means if you rank hospitals from the lowest to the highest in their negotiated commercial price, the 25th percentile is about 363. The 75th percentile is 1,275. If you look at the 10s versus the 90s, you have about 10 times variation, right? So 9 times variation. So from about 200 to about 1,900. This, again, is the median negotiated price of this extremely common CT scan. You can look at other services, very similar pattern. Then we published another article last year on the International Journal of Surgery. We look at the 22 services, very common surgical services, and we got the same result. So you can see, let's look at the first one, removal of the breast lesion, and then, the 25th percentile versus the 25th percentile is 22,000 versus 60,000, and then the 10s versus 90s, you can see about, that's more than 10 times, right? More than 10 times, from the 847 to almost $10,000. So what does the data tell us? Money is left on the table, right? Many employers, many payers, patients are leaving money on the table. You are not getting the best deal. There are much lower prices, and there are people actually paying those high prices, more than 10 times of other people are paying, and this is commercially negotiated price. So keep going, cash price. Thanks to the price transparency rule, hospitals must disclose their cash price. So what's cash price? Unilaterally determined by the hospital for patients who do not have insurance or who do not want to use their insurance. So we look at all the 70 shoppable services designated by CMS. So again, these 70 very shoppable, very comparable, advanced scheduled services. So this is just a snapshot of those services. Okay. If we look at so I'm just ignore those services, but this is just an example. The percentages, so in the brackets, we're looking at the hospital percentage. Okay. So if you look at the left column, tells us the cash price is very similar to the median negotiated price for the same hospital. So let me repeat. For the same hospital, their unilaterally determined cash price is very comparable. It's about the same as their bilaterally negotiated price with insurance companies. Okay. Then the middle column tells us about 10% of hospitals set their cash price lower than their lowest negotiated price. So what do insurance companies do, right? They are not even giving us a price comparable lower than the hospital's unilaterally determined cash price. So something's wrong. Then we also look at the factors regarding the compliance. Why do some hospitals disclose? Why do some hospitals conceal their price? So this is the data, the study published on the Journal of General Internal Medicine last year. So we look at the reason behind the disclosure. We found there's strategic concern, meaning that hospitals are playing some games and there's some peer pressure, meaning that if your friends in the same market, they are disclosing, then you are more likely to disclose. And also there is some compliance cost concern for small hospitals, like rural hospitals, right? For them, then to comply, to put the data up there is quite challenging. So there is a strategic reason and there is some compliance cost reason. So this is what the data tells us so far. So we want to have like Chris presented, right? We want the data to us the truth, then we can find our next path. So let me give the big shout out to 3 people here today. So first one is Cynthia Fisher. So Cynthia Fisher is an incredible entrepreneur and leader. So her dedication and vision is indispensable for the passage of this hospital price transparency rule. Without her vision and effort, we would not have the hospital price transparency rule, and we would not have this conference today. Second, Chris. So Chris and his company, Turquoise Health, has been providing incredible data. We have been using their data. They are literally transforming chaos to order. Why do I say this? Can you imagine how reluctant hospitals are, right, to prevent from disclosing data? So it's really a chaos. And his company has been providing really the best data, the very amazing data. Without data, all the research I have presented is impossible. And finally, Hunter Kelly and Arnold Ventures. So Arnold Ventures and Hopkins, we have a very much aligned interest. That is, use research to reduce the cost for consumers, for employers, and for taxpayers. And Hunter has been supporting us for like almost 7 years, right? Without his support and our research, the whole Hopkins research would not be possible. So to Cynthia, Chris, and Hunter, thank you very much. And I want to be on behalf of my research colleagues in Hopkins and other research institutions, and for all who have benefited from the research we have done, thank you. I want to thank you all. And also for you who take time here and join virtually, thank you very much for your interest and for your time. Let's keep using data to tell the truth, tell the economic reality, and then we can find the best path forward. Thank you.
Wow. So after my red eye last night, I was worried that I wouldn't have energy, but that really pumped me up. So thank you, G. And I'm Chris Severn, like G mentioned, from Turquoise Health. It's great to be here. I think before I get into the slide deck, something to know is that my whole past was in these secret hospital negotiated contracts. For 10 years of my career, I was just looking at these contracts and building software to help price claims. And sometime in 2019, from some of the work of Cynthia and people here, these laws appeared from the sky. And to an entrepreneur like myself, we had to do a double take, Adam and I, and say, hey, if this is true, if hospitals publish their prices, we need to be in a different business. And so the good thing to note is, Turquoise Health, we're a startup. We've been around for a year and a half, and it's amazing how some of the legislation created the incentive for startups like ourselves to start. And so here I am today talking to all of you, a very new business. I have not been doing this as long as G and some of you and Gloria, but it's great to talk to you today. So just going into why we exist at Turquoise, we all know about the transparency rules. We call them the triumvirate: the hospital price transparency rule, the payer price transparency rule, and no surprises. What we're doing at Turquoise is essentially building just as much software as we can to support the rollout of these rules. We read the laws in 2019, 2020. I actually printed them out, put on my, not reading glasses, I just have glasses, and read through them with a highlighter. And there were plenty of places in the laws that invited third-party entrepreneurs and innovators to make use of this data that's coming out. And what really struck me is that there was no data use restriction versus all payer claims databases and the world I was coming from. You really can't look down at the NPI, CPT code, and payer level. And so this really got us excited. And the first thing we realized, New Year's Eve of 2020, was, dang, this data is going to be really hard to get. So Adam, my co-founder, and I were ready with a few engineers to start getting the first hospital files on January 1st. We started on December 31st. So fireworks are going, and we're grabbing these hospital files. And It was very hard. I think Chris was talking about it. January, February was such a slog. We had about 1,000 hospitals in the database when we first published Turquoise Health, and connected with G. We were written up in the Wall Street Journal, and the note was, hey, hospitals have not really complied, but some have. And so here's the data. You can find it on Turquoise Health. And since then, we're happy to report we're at around 4,500 hospitals in the database. The increased fines have really helped more hospitals post. A lot of the issues with hospitals posting last year have subsided, and there's a decent amount of substantial compliance in the database. When it comes to the quality of the data, the machine readable files, Cynthia knows that there's a lot else wrong with these files and how to access them. What we analyze at Turquoise is just the raw contents of the files once you've had a team of engineers that go in and parse the data out. And so we break out these files by how many large pairs are in the files, how many inpatient rates are posted, and 60 other attributes of the quality of the files. And it's still very hard. We're working on, with some panels on standardizing the file. And our CTO, Adam, when he interviews engineers to come and help work on these files, he asks them, hey, some people see this as a huge, impossible burden. Other people see this as a video game where every file is a new level to beat. He's like, I'm the latter, what are you? And so we're still playing the video game. We update our data every day, and we see new hospitals come online. And so I was going to make some points about price variation in these files, but we've talked a lot about that today. So what I'll show is kind of what we're up to at Turquoise with all this data. So we now have, I think, at least over 1 billion hospital rates in our database for 4,500 hospitals. And what we're trying to do at Turquoise is get all the data in one place, queryable, as simple as writing a search term into Google, where you could filter down and right now see the facility fees associated with hospital charges in the United States. But the big problem from there, in the world that I come from, is hospital contracting. It's great having the data there, and what I tell people is imagine, starting eBay, where you have all the prices listed, but you can't bid or buy now. That's a pretty sad marketplace. It's very static. And so what we've been focusing on at Turquoise is not just getting the data out in front of as many purchasers as possible, but to create an interface where you can actually participate in the market and participate with providers. And as a purchaser, you can bid, you can buy now, you can directly contract, and you could use data at the foundation. And previously, because all this data was private, it was really flying blind to do this. And so one thing to show is just that still kind of surprises folks, and when you can drill into this level of granularity, is we're looking at colonoscopies here on the Turquoise platform. And it looks like we have Union Hospital. And when you expand to see some of their payer rates, there are not only variation within the hospital, there's variations within the payer. And if you look at this, you've got different Aetna lines of business and plans. And at the bottom, if you look really closely, it even says Aetna Sony. And so what I'm guessing is that that's a Sony employer Aetna rate, and that's even different from the other Aetna rates. And so a lot of the presentations that we've seen today, where you can really look at some of the NASHP data, some of the RAND data, it's super powerful. It's also kind of interesting to drill into exact data points and say, this is exactly the colonoscopy facility fee at this hospital. And if we're negotiating, or if we're sending 100 employees to go get their colonoscopies at this hospital, we have a very, very relevant data point to bring up. And so we've spent a lot of time getting this data into one place. We can't wait for it to be a little bit more standardized, and so that we can spend more time on some of the other stuff I'll talk about in just a second. There's a big problem if we all think about the way the hospital data works right now. It's hospitals competing with hospitals. You really only have facility fees. You have professional fees for hospitals that employ professionals. What we're missing is downward pressure from other sites of service. And so I am getting married in 2 weeks. I'm going on a honeymoon. I'm coming back, going to Fiji. I'm coming back, and I am sitting down for a long time when the payer data is posted on July 1st. The payer data has in-network negotiated rates at all sites of service, at all NPIs, hospitals, and below. And what this means, as some folks were talking about, is you can really drill into that same level of granularity and see hey, the ASC down the street is this much more affordable. The office visit, the telemedicine visit, and we need some pressure from other sites of service to create a competitive market. And so we're excited for the payer rule. If you try and email me during July, I'll probably forward to someone on my team. And so the biggest thing is, where might price transparency data lead? It's still very early. When you look at some of the Turquoise data right now, it's still maturing. Hospitals are learning how to publish this data. As this data matures, through 2021 and beyond, we'll first see this hit some commoditized shoppable services like G was talking about. I always use the example of colonoscopy. You could even drill backwards at simpler services, E&M, labs, radiology. As this works its way through with the payer data and we get more sophisticated how we represent this data in all these schemas, we'll see it wrap towards emergent and cancer care and more complex inpatient episodes. But the open secret in our industry is that even though hospitals are publishing their prices, there's really not a price for some of this care. It's a formula. And so until we get to more sophisticated ways of representing those formulas and these disclosures, we have some limitations, and that's what Turquoise is kind of working on in some of our contracting software that I'll show in a moment. And so, how do employers use this data? There's a couple different ways to look at this. And thankfully, we now have a lot of different resources, both public and private, to access the data. What we're trying to create is a data foundation for negotiating the cost of care. Employers can use this data, they can benchmark it with their various resources, and then what we're really working on at Turquoise are data-powered contract negotiations. So we have providers and we have health systems here in Indiana, we have health systems across the United States, we have surgery centers on one side of our marketplace, and we have purchasers on the other side. And what we're building is a streamlined contract negotiation platform where any purchaser, all the way down to the smallest group, can directly contract with a provider. And when we were building this at Turquoise, there was a piece written by Dr. James Capretta, who really inspired us about how Mennonites contracted in Philadelphia for care. And that really got us going at Turquoise of, hey, if they can do it, why can't you have some simple, streamlined contract negotiations? And so I just want to bring up, some ways that employers maybe weren't empowered before to contract for more affordable quality care. And, we've got this workflow we're thinking about. And then the one note I want to end on is, we get this question all the time. Turquoise, you're a price transparency company. We have a public website where we show the prices for patients, but you just showed us a bunch of B2B stuff. What about patients? And something we're really thinking about at Turquoise is, by the time this data hits the patients, because these formulas are so complex and the benefit designs and the managed care reimbursement constructs are so complex, the data is really inaccurate. It's not very credible. It's a range. And so by building these contract negotiation platforms with rock solid algebra and upfront pricing at the B2B level, we're cleaning up this data by the time it hits the patient. And so we're inviting providers and the radiology group with really clear upfront package pricing to come on the Turquoise platform, create some simple, clear algebra on our platform, and surface that to purchasers and to patients. And so we've got a lot of work. I feel like we're 1% of the way in, but I just wanted to show some stuff that hopefully is a little bit empowering, more than if we were doing this conference in 2015. So it's nice to meet you all, and I think that's all I got. So yeah. Fun.
Thank you both so much. You don't have to stay up here all the way through lunch unless you really want to. But yeah, that was really outstanding. I love data. I am a data geek, so I really, I've found that it's just unleashed all of us. We're now able to have information thanks to your great work that we've never had before. I look forward to seeing your platform when it's 99% done. Okay. Thank you so much.